Hi everyone, thank you for joining us. And I just wanted to tell you that my name is Terry Wilder. I am the case manager at Charlotte Rescue Mission Dove's Nest. First, I want to tell you that we're going to talk about the brain for a little bit. I want to start out by telling you that addiction is a primary chronic disease of the brain reward, motivation, memory, and related circuitry. When the circuits are not functioning properly, they lead to problems in their social, home, employment, and spiritual life. Addiction is defined as one's inability to consistently control their behavior, cravings, relationships, and poor emotional responses. Without treatment and recovery, addiction is progressive and can result in disability or premature death. Addiction impacts the brain on many levels. The chemical compounds in stimulants, nicotine, opioids, alcohol, and sedatives enter the brain and bloodstream upon use. Once a chemical enters the brain, it can cause people to lose control of their impulses or crave a harmful substance. When someone develops an addiction, the brain craves the reward of the substance. This is due to the intense stimulation of the brain's reward system. In response, many continue use of the substance, unlocking a host of euphoric feelings and strange behavioral traits. Long-term addiction can have severe outcomes, such as brain damage and even result in death. What I want to show you next is I have a PowerPoint here, and this might help explain some of this a little bit better. We're going to talk about the brain on drugs. So here in this slide right here, we've got a brain that is healthy versus a drug abuse brain. Take a look at the brain on the left. That's the healthy one, and the one on the right is the drug-affected one. See quite a difference there, right? So now let's go and look at a brain of a meth user. So you see in the diagram there, the brain on the left is the normal brain, and the brain on the right is the brain of someone who is a meth user. There is a noticeable change in the way the dopamine is used in the brain. Dopamine is a neurotransmitter, the chemical messenger. Dopamine plays a role in how we feel pleasure. It's a big part of our unique human ability to think and plan. So let's go look at this next. It's uncontrolled pleasure. Research has shown that the drugs most abused by humans includes opioids, alcohol, nicotine, amphetamines, and cocaine. Create a neurochemical reaction that significantly increases the amount of dopamine that is released by neurons in the brain's reward center. The result of this dopamine overflow is the feeling of being high. So in this next slide, what we're looking at is the limbic system. You'll notice the picture on the left, that's the full brain right there, and in the center, you see the limbic system. Well, over to the right, it shows it a little bit more detailed, and that's the area where the dopamine hits. So let's go on and take a look at the next one. Here, intoxication creates a strong and rapid learning response in the brain. The brain associates drug use with the feelings of pleasure. This association leads to higher and more frequent drug administration in order to experience more pleasure of the reward response more often. Additionally, the intensified dopamine response in the brain that mood-altering drugs produce does not naturally stop once the behavior is initiated or completed, as in the case with natural reward behaviors such as eating or having sex. As a result, cravings for the rewards associated with the drug continue to occur, even during drug use, which leads to compulsive, repetitive use. All right, let's take a look, because here, then there is the reduction in dopamine receptors has a twofold impact on addiction. First, reduced dopamine reactors are associated with impulsive behavior that has escalated and compulsive use of drugs. Two, reduced dopamine receptors also result in a state of known as anhedonia, which is a feeling of numbness or a loss of pleasure in activities that were once enjoyed. The depressive feelings of anhedonia can drive a user to administer drugs in a reactive attempt to feel pleasure again, especially in a state of low self-control. Self-control is further effects of long-term drug use begin to erode gray matter in the brain, reducing users' ability to consider consequences as a result of reduced function and reducing the ability of regulating brain functions. So now let's look at the next one. It says, stop doing that. Do you hear me? Well, think about it. When you're talking to a child and you're trying to get them to do something, they're of course hearing you. But if you're talking to one who is using drugs, they're not going to hear you because of the dopamine. And once they're coming down in that anhetamine, they are having a feeling of numbness. And so they're not. They're just very relaxed and know they probably don't hear what you're saying, not comprehending what you're saying. So stop doing that and get your life together. When a drug user chooses to abruptly break from drug use instead of gradually decreasing consumption, the drug's stimulatory effects on the reward system are no longer present. As a result, the seesaw tips in the other direction and activity in the brain's reward system drops, resulting in an anti-drug low, which can include symptoms like depression and irritability. It is not just reward systems in the brain that are affected by drug withdrawal. For example, if heavily dependent alcohol drinkers stop drinking, they often face a range of cognitive and physical symptoms. Alcohol is a sedative drug that slows brain function. To compensate, many brain circuits increase the basal level of activity. Without alcohol present, these circuits become hyperactive, resulting in anxiety, hallucinations, seizures, and even death. Let's take a look here. Talk about treatment. The brain can recover, but it takes time. Recovery is occurring in the prefrontal cortex after a period of abstinence. Furthermore, other research has found that number of days abstinent from alcohol and other drugs was associated with improved executive functioning, larger cerebral volumes, and improved short-term memory. So let's look at this. Repeat that, please. Drug treatment stimulates the brain's development and increases of dopamine. Identifying what triggers them. Things like people, places, and things are triggers for an addict. Teaching and practicing coping skills. Teaching and practicing problem-solving skills. Developing support networks with 12-step. It is very important that they have that sponsor and they have those supporters that they can contact to help them through any ups and downs that they may have. Understanding boundaries and practicing them. That may not sound like a whole big deal, but having their boundaries and teaching them how to hold them strong is a very important thing. Medication therapy, teaching and practicing alternative behaviors and activities. So lastly, what about relapse? So NIDA research shows that drug addiction relapse, regardless of treatment method, is fairly common at 40 to 60%. That may sound like a poor success rate, but it's actually in line with treatment for other chronic diseases. For example, people being treated for hypertension and asthma have relapses of those conditions about 50 to 70% of the time. Just remember, it is possible for the brain to recover.